Hey y'all, welcome back to our channel. We are the Road Trotting Guys, Derek and Mike, and today we're going to be talking about a topic a lot of people said we should cover, which is the difference between healthcare in Denmark versus healthcare in the United States of America. So let's get into it.
So to start with, give a little overview of the Danish healthcare system, at least as we've learned about it in the last 4.5 years living here in Denmark. Key point about the Danish healthcare system is that it is primarily a public system. That means that doctors and nurses are public employees, and hospitals and clinics are primarily run by the state, though in Denmark it's primarily done by the regions, not by the central government. The other key thing in Denmark is that your general practitioner is going to be the key person. That is a doctor who's going to be on your yellow card, which is the card that everybody has that gives them access to healthcare all over the country. That doctor is really your way into the system. They dictate where you're going to go to, if you can go to different clinicians or specialists or things like that. So in general, with the Danish system, the main benefit is that it's universal. Everybody has access to it, and it's generally free at the point of sale. The downside of that, obviously, is that it means that sometimes you can't always get what you want, and it can be a little bit bureaucratic at times, especially if you and your doctor don't necessarily see eye to eye on what you may want to do.
Now, in contrast to the Danish system, the American system is more than a little bit different. Most people have private healthcare, which means that doctors and nurses and medical staff are private employees. They are paid by either the government, insurance companies, or by the consumer or patient. Now, in the US, you're generally going to be covered by 3 different types of insurance. Most commonly, if you're working, it's going to be employer-provided insurance, which is paid for from payroll deductions and tied to your job. If you're over 65, you may qualify for Medicare, which is insurance provided for America's seniors, which is paid for from payroll deductions while you're working. And if you are poor and underprivileged, you could qualify for Medicaid, which is healthcare that is provided by the government from taxes. So famously, Obamacare helped to make insurance a little bit more fair and covered some of the holes, because there are people that didn't fit into any of those 3 categories, like those who are self-employed or if their company didn't provide health insurance. It also did some famous things that are very popular, like extending the amount of time children can be covered by their parents up to age 26. And it filled in and made illegal some things like pre-existing conditions. So before, your insurance company used to be able to say, if you have a history of stomach ulcers, then we're not going to cover you because we found out about it and you're too high of a risk. In fact, they used to be able to do things like charge you more money in your premium or refuse to give you coverage at all. That is now illegal. So some of the pros in the system are obviously that if you are poor and underprivileged or over a certain age, you can have coverage. And if you are of working age, you can decide the amount of risk and the amount that you want to pay. And if you decide that you want to go with a cheaper plan that has a higher deductible, for example, then you're in control of that. Now, some of the cons, as you may already imagine, are that if you have private insurance through your employer, you may be tied to a toxic job or even a toxic marriage or living situation if you have insurance through your job or through your spouse. You can also find yourself in really catastrophic situations where the insurance won't be enough to pay, or you're stuck with very high deductibles, and sometimes insurance will even have a cap or a maximum they'll pay in each calendar year, which means if you get sick or you have some kind of accident or really severe medical condition, it may not be fully covered by your insurance, and then you're kind of in trouble. So as you may imagine, there's a lot of complexity and hidden costs involved in the American system, but it does give you some flexibility, and we have made great strides in the last couple of decades in providing care for more and more people. Okay, Mikey, now let's get into some common misperceptions about both systems. We're going to throw out some assumptions that people make about the Danish healthcare system and the American healthcare system and see if we can correct the record a little bit. So most people in America would think or are told that the Danish system means everything is free and all of your Medicare costs and medical costs are covered.
Yeah, and that's obviously not entirely true. I mean, yes, we pay high taxes in Denmark to be able to get the good health care that we have, but there's still some things you have to pay for. So one of the big ones is medication. Although prescription drugs are pretty heavily subsidized, you're still going to have to pay something every time you go to the apotheke to get something. Also, there's a lot of specialists that are outside of the public system here. So that means if you want to go to a dentist or a chiropractor or some other specialists that are out there, you're going to be paying for that one out of pocket. Though a lot of larger companies in particular do have private insurance schemes, I should say, that you can sign up for that can help cover some of these costs. So Derek, here's one for you on the American system. So you would think with all the stories that you read about how awful the American system is and the way that we described it here, that in general Americans must hate it. They must hate their healthcare, right?
Yeah, and that's not quite true. So polls show that something like 2/3 of Americans are actually quite happy with the healthcare coverage that they have. And it's something even more like 3/4 think that they have good or better than good healthcare provided to them. So it does show you that there's a bit of a disconnect between those real catastrophic things. Most people go through life without really having to lean heavily on their insurance. But I would say that 1/3 that have a problem, it's because they themselves, somebody in their family, or somebody that they know has had a catastrophe. And if you've had to deal with something major like that, then you're not always covered as well.
Yeah, and this is something that I think blows the minds of people in Denmark. What happens is that if somebody has like a major accident or maybe a child of theirs has cancer, a big thing, especially in the Philly area, they call them beef and beers. So they're big fundraisers you can have to raise money for medical coverage or things like that, where you have a bar will host something and you can get yourself a cheesesteak and a beer and things like that. It's very common to have fundraisers like that for families that are stuck with very unlucky, unfortunate medical situations.
Yeah, so you're buying beef and beer to pay for a child's medical expenses. It's kind of icky. If you ask somebody in Denmark, they would probably have a real problem with that kind of system. And I think the reason that Americans are satisfied with it, though, is because they're comparing the current healthcare that they have to not having healthcare at all,
Sure.
rather than comparing the healthcare they have to something like a national healthcare program like we have in Denmark and all around Europe. Even though the systems are different across Europe, every EU country has some kind of national healthcare program. Okay, Mikey, another one that a lot of Americans think is that to have a system like Denmark has, you have to get rid of all private insurances, and nobody in Denmark has private insurance. Is that true?
No, it's not entirely true. That there are people that have private insurance here, and in fact, larger companies typically give it as a benefit. I know we've heard from people, one of the ironies here is that it means that you get private insurance when you don't quite need it as much when you're working age, and then when you're older and it could really help you, then you don't have it anymore because you're done working. Generally gives you access to maybe having lower fees when you go to certain specialists. I know this year at my company we got dental coverage for the first time to have some dental coverage taken care of, but it's not totally common, I'd say, across the board, but some people certainly do have it and some companies do offer.
It also helps if you do need to go to a specialist, you don't have to go to your general practitioner first. You can skip the GP and go right to the specialist.
Yep.
It's a big one.
Yep. Okay, Derek, so another thing on the American system, so you'd think by having for-profit insurance companies in there and maybe paying lower fees as you go along that in the end, Americans pay less for healthcare than Danes.
Right, and although sometimes they may pay less out of their pocket if they don't use their insurance, if they only have that one little payroll deduction, as a country, Denmark pays less than the U.S. It's actually half as much as a percentage of GDP than what the U.S. pays for healthcare costs. And part of that is because there's a very tight bureaucracy around the system because it's a public system and nobody's really dipping into it. Nobody's making money. You have to remember that a for-profit insurance company is trying to, what? Make profit. So in the U.S., there's a lot of extra costs because, you need to pay those insurance company CEOs the big bucks.
Yeah, and there's other places where you pay a lot. So for example, doctors in the U.S. get paid a lot more than they do here in Denmark. A lot of that is because if you're a doctor in the U.S., you've gone into massive debt to go through medical school. And it's kind of an investment you make that you recoup by having higher salaries than you'd get here. Also, you'll see things like prescription drugs are all over the place in the U.S. and they can advertise as well. And in fact, it's been well founded that because there's no controls on prices for pharmaceuticals and things like that, that the cost of drugs is higher in the U.S. than in countries like Denmark or elsewhere that has more government controls and government buying power on these things. It just means there's a lot more pass-through costs that all just add up in the end for different things.
And another one that you hear a lot, especially in the Fox News crowd to scare people, is that in Denmark, wait times are ridiculous and you can never get in to see your doctor. Is that true?
So not really, but there's some nuance here as well. So generally, if you need to see your GP, it's a little bit probably more challenging for regular things than we have in the US, where you can just call the doctor and always get an appointment. They'd squeeze you in there. Here, kind of depending on the severity of your case, it may be, can you come tomorrow? Can you come later in the week if it's not that urgent? Also here, I mean, one of the ways that you control costs is by having a little bit of control on what needs to be done. So if there's serious things that have to happen, then you're going to get treated right away. I mean, there's world-class healthcare here. Yeah. For something that's a little bit more quality of life, yeah, you may wait a little bit longer. Again, partly because there's fewer specialists here. In the US, you want to go into a specialty because you can make a ton of money in your private practice. Here, it's not quite as many that you're going to have for different things. So yeah, you may wait, and you've had that experience with some specialists having to wait some months to get an appointment with them.
Yeah, I would say whenever I need healthcare that can be covered in my GP's office, I get in within 24 hours. I've never had to wait that long. We go into the online portal, we book an appointment, and it's done. Whenever I've had to go see a specialist, of course I've gone to my GP first, and at that time you can wait a little bit. I went to a lung doctor for asthma, and it took me a few months to get in. Now, specialists back up in the US too, so I don't know who's getting into like an asthma doctor like within a couple of days. I don't think that's that uncommon, but that was the one time where I had to wait a bit longer than I've expected. But to get in to see a regular doctor, it's not that long.
So that's kind of a good segue to talk about our actual experiences with both systems. And I can say in the US, one of the challenges that we've had is both of us, luckily, knock on wood, have been in pretty good health. And we've also moved around a little bit. So it means we've changed doctors pretty frequently. And that means that it's really hard for us to be able to keep track of the different things that we've done. There's no central place I can keep track of things like what shots or vaccinations I've had since basically I left my parents' doctor and when I went to college. In Denmark, it's so much easier because everything is just on an app. I can see everything that's happened to me since I arrived here 4.5 years ago, all in a single portal. And it's super nice too because they have various apps for different things to see when prescriptions need to get filled, to send a message to your doctor, get a message from your doctor, schedule appointments. Having everything centralized is really, really nice.
So yeah, records are really good, and that does make it convenient. But one thing that's not convenient is if you don't like your GP, you actually get your general practitioner, your general doctor assigned to you from the state. Now you can change it. There's a fee involved in that. But in general, they're in charge of everything. So if you think you have a certain medical need, if you know your body and you're advocating for your own health, that can be looked at really poorly, and your general practitioner may just say, no, I'm not giving you a referral to that specialist, or no, I'm not going to prescribe X, Y, and Z. You are just kind of stuck. Now, there's some ways around it, and it is possible to change your doctor, but that can be a really uncomfortable thing to do and a timely process when you may not have the time to spare.
And I think it's a little bit harder for us as foreigners too, because if you grow up with the system, I think you know how to work the system, play with the system, and things like that. And it's been something that's been a little bit more difficult for us when we've had to go through, but we're learning. Yeah. I think one of the things that we've learned here is that the general Danish approach towards medicine and health is different than in the US. In the US, the concept is there's always a pill for that. And in Denmark, the concept is, well, why don't you just have some hot tea and echinacea and you'll be fine. That's why one of the things is that if you have like a little cold or something like that, and we've seen these kind of back and forth in the comments too, and in the US, you'll go to CVS, get yourself some NyQuil, knock yourself out for the night, and wake up feeling a whole lot better. You can't find anything like that here in Denmark. And in the US, there's 10 different brands of painkillers. Here, you just get generic paracetamol or Tylenol for yourself. So a little bit different approach, a little more kind of rugged Viking, I guess, approach to medicine, I'd say here. Kind of walk it off a little bit by comparison. That's been a little bit different for us to not have the plethora of options that we're used to in going to a US drugstore.
Yeah, and I know even based on some of the comments that we differ with a lot of our viewers that are Danish on this. I'm sorry, but I still don't understand why. Yes, I know the body heals itself, but if you can treat some symptoms, why not make it a little bit easier for your body to heal? But, that's just maybe two different countries and two different systems.
Two different approaches.
And if this was an easy pill for you to swallow and the medicine went down easy, then maybe give the video a like. And if you haven't yet, subscribe to our channel so you can get more content just like this. And hit the bell for notifications. We drop new videos on Thursdays, and we'll see you back here next week. Thanks, guys.